Hi everybody, welcome to the second part of the story, and this time, as I promised, I'm going to be taking you guys through contraceptives and what they are, what do they do, and most of the side effects really, because they have been avoided. Have you ever read, okay, let me just ask you, have you ever read that small package thing that comes with the medication box? So in this video, I'm going to be discussing most on those and the physiology behind. So let's start with what are contraceptives. Contraceptives are methods, devices, or drugs, even barriers that are used to prevent pregnancy. So we have two types. We have hormonal and non-hormonal. With hormonal, we have combined oral contraceptives. They contain estrogen and progesterone, and in simple terms, I'm going to simplify this. I'm not going to include the pharmacodynamics or pharmacology behind it, but what I can say is that estrogen prevents follicle stimulating hormone, and progesterone decreases or prevents luteinizing hormone release. With that being said, there's no ovulation, there are no menses. So what are these drugs? We have, under estrogen, we have your estradiol valerate, which is available in South Africa. We have medroxyprogesterone. They are combined, and there are ways on how to take them, but I'm not going to dwell much onto them because it will be more of an academic video than to actually be an outreach or a way of me telling the public on what are contraceptives. So we have our physiological effects that happen when a woman takes these drugs. First of all, let's start at the vagina. What happens there? The vagina has microorganisms. Your bacilli, let me just put them that way, the simplest way, bacilli. These organisms are responsible for the acid environment, which is responsible for protecting you against infections. Taking those drugs or medication will decrease these bacteria, making you more susceptible to infections. Now, going inside the vagina, we have the wall. The wall becomes really dry, and that will lead to painful penetration when you are having sex. And going inside the cervix, the plug there increases. That makes it impermeable for sperm to pass through. And inside the endometrium, it becomes inactive because there's no progesterone, there's no estrogen, there's no proliferative phase that is going to take place. And then we're going to go into the fallopian tubes. At the fallopian tubes, same thing, they're not going to be working so as your ovaries, because there's decreased levels of the hormones that actually stimulate them to function. Now we're going to move up there. What happens at the breast? The breast becomes painful, and I can say reduced in size, and so that is what it is expected of them. And now we're going to move into the side effects of these drugs. What are they? You're gonna feel nauseous for the first 3 months if you start using them, and there's gonna be pain, tenderness of the breast. There's gonna be irritability and a sign of depression because they also affect the central nervous system. There is gonna be a bit of loss of libido, but they say that it's rare, but it can be there. So loss of libido simply states that you will not want to have sex anymore. You lose interest in having sex. And there's going to be weight gain because there's some drugs like your progesterone, the norethisterone, norethisterone contains more progesterone, which will cause an increase in appetite, leading you to eat more. And that will result in your weight gain. And also, with that being said, we are going to move into the non-hormonal ones, which is let's start with the barriers. So the barriers, we have the condoms, right? the female condom, the male condom, and I hope you know them. I think I have them here. I can't find it. Okay, we have the male condom and the female condom, and also we have a diaphragm. A diaphragm is a device that is put to close up your cervix, which will prevent sperm from ascending up. And then again, we have your spemicide. The spemicide are agents that are inserted into the vagina closer to the cervix, and then they get absorbed before coitus, before sex. After that, the sperm won't be able to penetrate through because they'll be killed by that agent. And now, with the methods, we have your calendar method, your 2-day rule method, your coitus interruptus method, and the simplest method of all that is applicable to everyone of every age, abstinence. So, guys, abstain, please, abstain. And another thing, what is this? On your 2-day rule method, this is what really happens. You asked, was there any cervical discharge? No. What about yesterday? No. And then both of you continue and have unprotected sex. It's that simple. So now the question is that reliable to you? Do you think that actually works? And now another one is the coitus interruptus, whereby like requires an experienced male, to be precise. When he's about to ejaculate, he needs to sense that and come out. But sometimes they come out too late, and that is the pregnancy. Another thing is the calendar method. With the calendar method, you're gonna look at your ovulation dates, on when are you ovulating, and then from that you work upon with your partner and you discuss whether you guys are gonna have sex on this day, on your last day of menstrual periods, or after 2 days of your last period. It will depend on what do you want. But for me, from my side, from my perspective, I say don't do that. Use better barriers or protection. Now let's go into the IUDs. We have intrauterine contraceptive devices, such as it's called Copper T, there's Morena, I think. And then these devices, and Gravigard. These devices simply are put into the vagina, and then they go into the uterus. Once they are there, they're gonna disturb the environment actually by releasing chemicals. These chemicals are gonna kill the egg that is gonna be released. These chemicals are also gonna kill sperm. So these are one of the safest devices, but they have complications and severe complications, I believe. And now we're gonna move into your emergency contraceptive pill, which everybody has heard of, I think, the levonorgestrel drug. It can be found freely at your nearest clinic, hospital, or even private, but at private it's not free. It's really not free. So once you get there, these drugs are useful in terms of when the methods that I just mentioned before are defective or didn't work, when the condom breaks, when the diaphragm slips off, when the contraceptives fails you. And these drugs, mind you, they are effective before 72 hours. After that, the efficacy has decreased. And so this is what happens. These are emergency pills. After an incest or rape, unintended, what is this? Ejaculation or failed coitus interruptus. When you decide to actually have unprotected sex and you don't trust the medication that you've been taking or the methods that you've been using, you can go for these. And also, I forgot to mention, there are patch whereby like they're put on your skin. These are gonna release a constant amount of combined contraceptives, and these are just gonna work as what I just discussed with you before. And now, on that being said, I think I've covered what I needed to say with awareness of contraceptives. Furthermore, if you want to learn more, I'll put a description below, and I'll put a site whereby like you can actually go and read thoroughly about them if you are that interested. And one more thing, ladies, since it's a ladies month, please, I plead with you, please go do a pap smear. Go do a pap smear, HIV and syphilis test. Any lady of reproductive age and who has had sex, please go do a pap smear. It's really important for your health and for your future, I may say, in terms of you family planning, making babies or wanting babies. It's really important. Please go do a pap smear. It can be done at your nearest hospital, private, I think clinic, but I'm not sure about clinic, but go and try, and if they don't do it, they will refer you. And most of the information that I just relayed to you right now about contraceptives, you need to consult first, because everybody, we are all different. We are all based on some different genetic genome, so everybody is different from each other. My methods or the way I'm describing them may not work for you, but if you consult and sit down with a doctor or physician or clinician, they will tell you the best approach on contraceptives, the ones that are going to work according to how your body is going to respond to them actually. And I think I've said a mouthful. Thank you for watching. Thank you for staying patient with me. Like, I've had a hectic week. Even my eyes are tired. That is why I'm wearing these glasses. I never got enough sleep, so just trying to hide these eye bags. Have a nice day. And remember, don't forget to subscribe, like, share, comment. Please comment. Say something. Tell me that you've learned something. At least. And if this was helpful or not. I'd like to hear from you. Bye.